Colon cancer, also known as colorectal cancer, is a type of cancer that affects the colon or rectum. It is the third deadliest cancer in the world, but when detected early it is highly treatable. Regular screenings are essential for early detection, but it is also crucial to be aware of warning signs that can indicate the presence of colon cancer. In this video, we'll explore the top 10 warning signs of colon cancer that you shouldn't ignore. Blood in your stool. If you see blood in your stool, it could be a warning sign and have several possible causes. Bright red blood typically suggests bleeding in the lower digestive tract, possibly due to hemorrhoids or anal fissures. However, dark, tarry stools can indicate bleeding in the upper part of the gastrointestinal tract, possibly due to ulcers or, in some cases, colorectal cancer. It is essential not to dismiss this symptom, and consult a healthcare professional for evaluation. Change in bowel habits. Changes in bowel habits can encompass a range of issues. Persistent diarrhea, for example, may be related to conditions such as irritable bowel syndrome, IBS, infections or dietary factors. On the other hand, chronic constipation or a noticeable change in the size or shape of stool can raise concerns about colorectal health, indicating the presence of cancer. Keeping a record of these changes and discussing them with a doctor is essential for proper diagnosis and treatment. Anemia. Anemia, characterized by a lower than normal red blood cell count or decreased hemoglobin levels, can result from chronic bleeding, which is a common complication of colon cancer. When tumors grow in the colon, they can damage blood vessels and cause bleeding that isn't always visible in the stool. Over time, this can lead to a decrease in red blood cells and, consequently, anemia. Symptoms of anemia may include fatigue, weakness, pale skin, shortness of breath, and dizziness. Loss of appetite. A sudden and persistent loss of appetite can be a sign that something is not working as it should in your digestive system. Although it may not be a direct symptom of colon cancer, it often accompanies gastrointestinal disorders caused by the presence of the tumor. In some cases, the tumor may be obstructing the passage of food, causing a feeling of fullness or discomfort, which may, in turn, result in a reduced appetite. Unexplained weight loss. Losing a lot of weight without making a huge change to your diet or exercise routine is a warning sign. Unexplained weight loss can occur due to a number of health problems, including cancer. In the case of colon cancer, weight loss can be related to the metabolic effects of the tumor and the body's response to it. When cancer cells consume too much of nutrients and energy, it can lead to loss of body weight. Nausea and vomiting. While nausea and vomiting are not typically early signs of colon cancer, they can occur in advanced stages, especially if the tumor obstructs the bowel or causes other gastrointestinal issues. Nausea can be a result of the body's response to ongoing digestive disturbances, and vomiting can occur if there is a significant blockage. If you experience persistent or severe nausea and vomiting, particularly alongside other concerning symptoms. Diarrhea. Chronic diarrhea that persists for weeks or months should not be ignored. It can be caused by various gastrointestinal conditions, including infections, inflammatory bowel disease (IBD), irritable bowel syndrome (IBS), or colon cancer. Colon cancer can lead to diarrhea when the tumor obstructs or irritates the colon, affecting its normal function. Any persistent diarrhea should prompt you to seek medical attention for a comprehensive evaluation and diagnosis. Abdominal pain. Abdominal pain, cramping, or discomfort can be indicative of a number of gastrointestinal problems, including colon cancer. This pain can vary in intensity and location, but persistent or chronic abdominal pain should be taken seriously. Colon cancer-related pain may occur due to pressure from the tumor on surrounding structures, inflammation, or nerve involvement. If you experience persistent abdominal discomfort, especially when accompanied by other concerning symptoms, it is important to seek medical attention. Chronic fatigue. Chronic fatigue is characterized by a persistent, overwhelming feeling of tiredness that does not improve with rest or sleep. It can significantly affect your quality of life and daily activities. In the context of colon cancer, chronic fatigue can result from several factors. Cancer itself can force the body's metabolism to work harder, leading to exhaustion. Additionally, chronic bleeding and anemia can contribute to fatigue. Pelvic pain. Pelvic pain is less commonly associated with colon cancer, but it can occur, especially in advanced stages, when the cancer has spread to nearby structures. The pelvic region encompasses several organs, including the colon, rectum, reproductive organs, and bladder. Therefore, pelvic pain can be caused by a number of conditions, including gynecological or gastrointestinal problems. Early detection of colon cancer is crucial for successful treatment and better outcomes. If you notice any of these warning signs or experience other unusual symptoms that worry you, don't hesitate to consult a healthcare professional. Regular checkups and a healthy lifestyle can also reduce your risk of developing colon cancer, so it's important to prioritize your colorectal health. I trust that you enjoyed the content, and click on the like button, subscribe to the channel, enable notifications, and share the video with your friends and family.